We're seeing more headlines ringing the alarm about ultra-processed food. The most recent articles highlighted a link to more than 24 health problems. Many of us are wondering if we should heed this warning, and the bigger question is, how?
Yeah, that's a good question. Dr. Natalie Gentile, the founder of Direct Care Physicians of Pittsburgh, is here to answer those questions for Wellness Wednesday. Thank you for joining us.
Thanks for having me.
All right, let's talk about ultra-processed foods, because I'm not sure that I know the difference. Processed foods I can pick out, but not ultra-processed.
Yeah, and I don't think that it's something that we need to be getting into the woods on, ultra-processed versus processed. So much food out there is just processed to some degree.
Yeah, okay. Yeah. So, but what are we looking at specifically? I mean, a lot of us go to the deli counter to get stuff to make sandwiches for lunch, but that's processed too.
Yeah, so a lot of meats are processed, like our bacon, sausage, for example. Foods that have labels on them with, labels of ingredients this long that you can't pronounce, we're talking processed there. Basically, as we go toward that center aisle of a grocery store, we start to get into more boxed, packaged things. We're getting more processed as well.
Yeah. And I mean, for a lot of people, processed food it's less expensive.
Right.
It's easier to get. I think a pack of ramen noodles is 35 cents for the pack, so you can have dinner that way. So I can see why people have an abundance of these foods in their homes.
Yes,
Yeah.
and in my line of work, I walk this line of, I'm not recommending that people eat processed foods by any means. We know that there is a significant link now that these articles you were referring to between processed food intake and the majority of diseases that are causing death and morbidity in our country. But at the same time, we really demonize these foods to a primary population who that's the only thing they can afford.
Right.
Or health literacy wise, that's the only thing they know is available to eat.
Mm-hmm. Let's talk about some of the things that we're finding though with ultra-processed foods and why this is so relevant right now.
Yeah, so if we look at the top 10 leading causes of death in our country, we're talking diabetes, heart disease, non-alcoholic fatty liver disease leading to liver transplant, hypertension, high cholesterol. These disease processes are a constant, especially in a primary care clinic. We're seeing this room to room. And these are causing long-term health issues in people, and we're starting to see links to what we're eating. And as far as food intake, the ultra-processed foods are a vast majority. If we look kind of at a pie chart, vast majority of what the average American is intaking is processed.
Yeah. So what do you do? I mean, do you go home right now and look? I mean, if you look in my cabinets, a lot of it is processed foods. I mean, do you just clear everything out and throw it all away?
I think for a lot of people that's unrealistic, right? And there's not shame in the game. I always say that. There's not shame in eating processed foods or having them in your home. But there are ways for you to start to minimize the intake of that and maybe swap out for things that may be just as affordable and accessible, but higher in nutrient content. We know about these ultra-processed foods, they're devoid of nutrients, right? And vitamins and minerals that we need. So look at beans and rice. We can get canned beans, we can get a bag of rice, pretty cheap, pretty affordable. We can go to the food pantry and get those, right? But we know that they're gonna make a complete protein and they've got nutrients and fiber that you need. Frozen fruits and vegetables, canned vegetables, these are affordable, more accessible, and give us the nutrients we need.
I'm so glad you brought up the non-alcoholic fatty liver disease, because this is a huge thing. We've had segments on Pittsburgh Today Live about this too. And a lot of that comes from sugar and the processed foods with too much added sugar. I mean, I was blown away by how much that can affect even kids. Wait until Logan wants the squeeze yogurts. They're so good, but they have so much sugar in them.
And in our era, when we grew up as kids with the low fat craze, what was replacing the fat? Sugar. I mean, something's got to taste good, right? So it's really diving into that ingredients label and looking at the vitamins and mineral contents, looking at the protein, the fiber, the added sugars, the saturated fat. And when we look at these processed foods, we're going to find they don't have the things we want and a lot of what we don't need.
I think they make it, I was going to say, this country makes it so easy to eat poorly. I mean, every corner, every place you turn, there's a fast food, there's an abundance. So if you have the money to pay for it, nobody's going to tell you no. You can eat as much as you want, and that fast food also is a lot cheaper sometimes.
And look at our schools. Look what's available at school lunches, and school breakfasts. And thank goodness, because there are kids where that's the only meal they're getting. Is breakfast and lunch at school. So we've got this delicate balance here, right?
Wow. So tell me what you do in your practice at Direct Care Physicians. What are you looking at in the bigger picture, running some of these tests and advising your patients?
Yeah, so we're diving into, first of all, the influences culturally, their socioeconomic status. These things are going to very much influence what they're able to afford, what do they like to cook. I have patients who don't really have a kitchen. So the way I'm going to be talking to them about cooking is going to be very different than the patient who's shopping at Whole Foods 2 times a week. You know, it's going to be a drastically different conversation. So understanding somebody's cultural influences is huge. And then we can do vitamin testing if we need to, worrying about, you know, people who have malnutrition or they're not getting what they need from their food. But a lot of it comes down to a simple conversation and an assessment of what they're eating and what they have access to.
It's great stuff. Thank you so much. Really good
Information.
conversation.
Thank you.
If you are interested in learning more about Direct Care Physicians of Pittsburgh and Rebel Wellness, we're going to have information on our website, kdka.com/talkpittsburgh.